Hello everyone, welcome back to my second video here on this channel, The Real WebMD, where we discuss medical cases from AskDocs, which is a subreddit, and I talk about them, and I explain my reasoning when I see these cases, and I explain what needs to be done, usually. So, without further ado, let's jump right into this case today. This was a very interesting case I came upon on Monday, I think it was last Monday, and very interesting because, well, you're gonna find out why it's so interesting in a second. So this was the case. Um, it was a 26-year-old female. They had a severe migraine, petechia, bruising, and nausea. Don't worry, I'll explain what petechia are in a bit. And they were asking whether they need to go to the ER. So then they gave some more details. They said for the last week and a half, they had been having daily migraines with flashing lights in one eye, extreme fatigue, loss of appetite, nausea, diarrhea, petechia, which again I'll explain in a second, um, purple bruising on the leg, which we call purpura, which I'll also explain in a sec, swollen lymph nodes in the neck and jawline, sores in the palate, and stuttering in speech. This is what petechia is. You can see these. They look like little dots of red and purple, and they are basically they're just bleeding under the skin. Um, so imagine you just develop these all over your skin. It doesn't look nice, does it? This is another example of petechia. These are a bit bigger than the first ones, and this here is what we call purpura, which are a bigger version of petechia. They're basically just petechia that are larger. And we also have some ecchymosis here. Ecchymosis are purpura that are even bigger. Like it's just three different names, but they're basically the same thing. Petechia are the smallest, purpura are the middle size, and ecchymosis are the largest size. And they're all just bleeding under the skin. So this is what this patient probably had. This here is the cervical lymph node, cervical meaning neck, of course, and that's an enlarged lymph node. And the patient was saying that they had enlarged lymph nodes all over the place, right? That's what they said. Yeah. So I mean, already I'm thinking this person is not okay. So I just wanted to make sure they knew what they were talking about when they talked about petechia and the bruising. I wanted to just see what it was, just to confirm that really this is happening, and then I was gonna ask them to go straight to the ER. So I asked them for a picture. I said, what do you mean exactly by slurring your words? As in saying words that make no sense? Or like, what do they mean by that? Or are they like having a heavy tongue? Because that could potentially mean strokes or mini strokes. Um, and then I asked them to send a picture of the rash. The patient did not reply for 3 days. So I assumed they had gone to the ER, and it was true they had, because they replied 3 days later saying that they had developed a condition called TTP, Thrombotic Thrombocytopenic Purpura, and they are currently in treatment. So, what is TTP? Well, that's a good question because TTP is quite a complex disease. Um, what's happening in TTP is that there is a problem with the blood and the blood vessel walls, and the platelets are which are the things that are responsible for stopping bleeding and making blood clot. Well, they're going haywire during when someone has TTP, and they're going crazy and they're just clotting up the blood crazily, and not only they're clotting with each other crazily and creating a clot. And this clot is when blood rushes through the vessel, this clot is destroying the blood cells, because like imagine you're on a highway going really fast and there's a bunch of cars parked in the middle of the road. Someone is gonna hit into those cars, and that's gonna create an even bigger accident and even more carnage. And that's what's happening. So why is all this happening? What's causing the platelets to go crazy in the first place? Well, we're gonna have to take a small dive into pathology and pathophysiology. So what's happening is there is something called a von Willebrand factor. This is a small protein which exists to aid in platelet adhesion. So it helps platelets to coagulate, to get stuck together in order to create clots when you cut your finger or your hand or whatever and you're bleeding. Von Willebrand factor is one of the proteins that helps to pull platelets together and create this clot that closes the bleeding and stops the bleeding. So what happens in TTP is that there is another protein called ADAMTS13. This is all not important, but I'm just explaining it for those who are interested. So there's another protein called ADAMTS13, and this protein is in charge of regulating the activity of von Willebrand factor. If this protein doesn't work, von Willebrand factor would work too much, so it would be unregulated, it would work too much, and it would start creating clots on its own. It should only create a clot when there's actual bleeding. So ADAMTS13 is responsible for making sure that von Willebrand factor doesn't create too many clots when they're not needed. All right, just to keep it simple. So when ADAMTS13 doesn't work, then von Willebrand factor goes haywire, and then platelets follow suit, and then you have this whole thing where you've got clots everywhere. So that's the basic of it, the basis of it. I'm not gonna go into more details. That's already too much details. I'm just gonna, yeah. So why would someone have a deficiency in ADAMTS13? Well, what would cause ADAMTS13 to not exist in the first place or to not work properly in the first place? Well, there are two proposed mechanisms, and I'm not gonna go into details again because I want to move to treatment and to symptoms. Um, So there's two main causes. The first one is genetic. Some people have an acquired problem with this gene, with this protein. And the other cause is autoimmune. So your immune system, for some reason or another, attacks ADAMTS13 and destroys it itself. I'm not going to go into more details about this. I will link an article if you're very interested in learning more about all of this. All right? It'll be in the description. Yeah, let's move into symptomatology. So, what are the symptoms of TTP? Well, this patient exhibited most of the typical symptoms, which include fatigue, tiredness, weakness, bleeding or petechia or purpura. So, any signs of bleeding. And in this patient's case, they had petechia and purpura. They didn't have any signs of bleeding. And when I say bleeding, I mean, like, for example, when you're brushing your teeth, you might see some extra blood, like a lot of blood, like it doesn't stop bleeding for minutes. For example, in females, they might have extra bleeding from their period, like 2 or 3 times more than they usually do. Um, some other symptoms include fever, and then we can talk about symptoms from complications of TTP, like, for example, when the nervous system gets involved. Let's say there are clots in the brain, you would have symptoms of stroke. So, for example, weakness in one arm or one extremity or part of the face, difficulty speaking, which they also had, a headache, flashing lights, or problems with the vision. Then you've also got problems when the gastrointestinal system is involved. So diarrhea, abdominal pain, vomiting, pain when you eat. You've got symptoms that have to do with your lungs. So chest pain, difficulty breathing, uh, coughing up blood. You've got symptoms that involve the kidneys. So, for example, blood in the urine, pain on urinating, burning sensation in the urine. You can also have pain in the extremities and the arms. So, yeah, it's very broad symptoms. And later symptoms include jaundice, which is yellowing because of the breakdown of the blood cells. So that releases some pigments which cause the yellowing of the face. So when someone has these symptoms and comes in and is tested, they do some lab tests to check the blood, and then they do some follow-up tests. They might even ask for a biopsy. And once they confirm the diagnosis of TTP, then treatment needs to be started immediately. And I cannot stress how important it is for treatment to begin immediately, because this disease can kill you. It is a mortal disease. It's very rare for someone to survive from TTP without being treated. So treatment needs to begin immediately. And treatment includes, first of all, correcting the problems. So, for example, if there's a kidney injury, correcting that. If there's a problem with, for example, the gastrointestinal tract, taking care of that. Whatever issue that this disease has caused, you need to take care of. Then the second thing you need to do is possibly transfuse blood if the patient has anemia, has really low blood because of the breakdown. And the third thing, and the most important thing to do, is called plasma exchange. So what happens in plasma exchange is that you are hooked up to a monitor, to a machine, and this machine takes in your blood and exchanges the plasma. The plasma is the fluid part of the blood. So the blood is made out of blood cells and plasma. The plasma is the fluid. And the fluid contains antibodies and all the proteins in the blood. You want to get rid of those antibodies because those antibodies are one of the main causes for destroying ADAMTS13 and causing TTP in the first place. So you want to destroy those antibodies. So you're taking them out of the system and giving the patient new plasma, new antibodies that would not attack ADAMTS13. There are other treatments. Sometimes we use steroids. Sometimes we use immunomodulating drugs that decrease your immune system strength. And sometimes the patient might need other supportive measures, like, for example, platelet transfusion, fluids, stuff like that. So that's basically how it's treated. The main thing is therapeutic plasma exchange therapy. Again, TTP is very, very dangerous, very scary disease. So if you think you might have this disease, please go straight to the ER, to the emergency department. But yeah, I mean, usually you would know if you had this, so you don't really have to think too much about it. If you see petechiae, you see purpura, if you have a fever and a headache and fatigue, you know you have. I mean, anyway, you need to go in to be checked. So go in, you know. So basically, that's all with TTP. Very weird disease, very interesting, a lot of details in it. Um, That's it for today. If you have any questions, please leave them in the comments below. I'd be very happy to answer and help in any way I can. Until next time, this has been The Real WebMD, and keep it real, everyone. Yeah, I know it's a horrible catchphrase, but it's staying. It's here to stay, so get used to it.